Hi, my name is Sky and today I'll be presenting my community placement project at Castlemaine Health on weight bias. Castlemaine Health is a rural public hospital predominantly focused on rehab, however also includes acute wards and has a hierarchy organisational structure with a very distinct chain of command, including the CEO, executives, as well as department managers who work more closely with staff on a daily basis. For this project, we will be working with a range of organisational units and key stakeholders in the distribution, collection of the surveys, as well as the education session. At Castlemaine Health, there isn't a large nutrition and dietetic department with a team of 3 dietitians, as well as a manager of nutrition and dietetics who do not have any formal meetings. The role of the dietitian is quite mixed at Castlemaine, providing inpatient and outpatient care, as well as community services. Inpatient services are provided in the rehab and acute wards, as well as the Community Rehabilitation Centre. Community programs also run, such as educational sessions for paediatrics for fussy eaters. There is no set model of care for dietetic assessment at Castlemaine Health, however the dietitians use the following to help guide practice. The dietitians receive funding through activity-based funding, specifically WAYS, when a dietetic referral is made and the contract is secured. This type of funding can impact the amount of time the dietitians spend with patients as well as the number of patients seen. Our project involved conducting a weight bias audit followed by an education session at Castlemaine Health. Now let's look at elements from the project management cycle. This project was deemed necessary through a needs assessment identifying felt, expressed and normative needs of the community. The literature indicated the prevalence of weight bias in society and more specifically in the healthcare setting. Alongside the felt needs of the dietitian and expressed needs of individuals having experienced some weight bias at Castlemaine, it was considered important to conduct a weight bias audit followed by an education session to reduce weight bias of the hospital. A thorough literature review was also conducted to determine a validated assessment tool for the weight bias audit. Based on the overall goal of reducing weight bias to lead to better health outcomes, the following objectives were set to achieve this. The planning of the project consisted of obtaining ethics approval, conducting a weight bias audit using 2 surveys, one for clinical and the other for non-clinical staff, which would be followed by an education session. There would be another survey post-education session to determine the effectiveness of the presentation. The education session was planned to cover what weight bias is, the harms, as well as strategies to minimise weight bias in the workplace. Surveys were disseminated through SurveyMonkey, which was open for 5 days, and paper copies of the surveys were distributed at the hospital cafe, in the pigeonholes of respective staff, and face-to-face, which were collected after 2 days. The education session was held the following week to Castlemaine Health staff, which covered the topics mentioned previously, as well as causes and common assumptions of persons with overweight and obesity, and the research behind long-term weight loss. In terms of the evaluation phase of the project, a post-education survey was conducted to determine the effectiveness and impact of the education session. Results from the pre-education survey demonstrated that the staff at Castlemaine were slightly non-weight biased and neutral. The Ottawa Charter consists of 3 strategies: advocate, enable and mediate to promote health, which are applicable to this project. Both advocate and enable are evident in this project through the literature review, which details the various factors that influence weight, as well as highlighting the inequitable access and differential treatment experienced by some individuals as a result of weight bias. This project aims to achieve the mediate strategy through dissemination of results, promoting other organisations to adopt a non-weight bias workplace. Similarly, this concept also aligns with the social determinants of health, which takes into consideration the multifactorial nature of weight, and planning to discuss its influences in the education session, as well as highlighting the common assumptions towards weight and addressing these with the evidence. Practical examples of how exactly to reduce weight bias in healthcare will also be included in the presentation, such as environmental changes. By addressing the social determinants of health in the education session regarding weight, it seeks to encourage a supportive community at Castlemaine Health, inclusive of individuals of all shapes and sizes. Communication theory is evident in the planning of the dissemination of the surveys with key stakeholders, as well as delivering and discussing the surveys to Castlemaine staff via face-to-face and email. The education session will also make use of communication theory, providing information both verbally and via the PowerPoint. The project report and findings will also be disseminated to the project supervisor and subject coordinator. The theory of planned behaviour is also evident in the education session and post-education survey by challenging the social norm that weight is under a person's control and increasing awareness of weight bias in the hopes of increasing participants' knowledge and changing their attitudes such that they change their behaviour, which will be assessed by the post-education survey, which will determine the effectiveness of the education session. Using the health belief model in this project, specifically in the needs assessment and implementation stage, The project addresses these concepts, specifically in the education session by discussing that weight bias is an issue in society and healthcare, the impact of weight bias on an individual, the benefits of a non-weight bias workplace, what weight bias looks like in healthcare, as well as providing examples of how to adopt a non-weight bias workplace. The health belief model is also present in the needs assessment due to a thorough literature review, providing the foundation for information discussed in the education session. Thank you for listening.